Hi, my name is Niels Linschoten. I'm an orthopedic surgeon in Baton Rouge, Louisiana. As you can tell, I'm not from Baton Rouge, Louisiana, but I consider it my home because I've lived there more than half my life. So I was originally born in the Netherlands, a country in Europe, somewhere between Germany and England. But I grew up in the Caribbean, where it's always warm and sunny and hot and spicy food and a mixture of cultures, so I feel right at home here in Louisiana. I came to the United States for a number of reasons, but professionally I was privileged to be at the Johns Hopkins Hospital in Baltimore, Maryland, where I received my orthopedic training. And after that I did another year at the Cleveland Clinic for further specialization in hip and knee replacements and associated difficult cases. So I was lucky to come to Baton Rouge and never look back. This is my home and here I am. I've practiced in Baton Rouge nearly 30 years. I'm not about to stop either because I love what I do. It's my calling, it's my purpose in life, and Lord willing, I'll do it for another 10 years or more. So what do I do? So well, there's the world of orthopedics, all the diseases associated with bones and joints and ligaments and tendons and what have you. And within that field, an enormous subspecialization has taken place. So there's doctors that do only sports medicine, there's doctors that do trauma, motor vehicle accidents and gunshot wounds, and there's doctors that do pediatric orthopedics, there's doctors that focus only the hand or a little finger, there's doctors focus on feet, and then there's doctors that focus on joint replacements. I am one of those. So what is our purpose and goal and mission in orthopedics is to deal with those patients whose joints have worn out and need to be replaced. So, of course, that kind of surgery is oftentimes the last resort. There's all sorts of treatments possible for arthritis of the knee or hip that can be effective, but there's a number of people, as a matter of fact, more than 1 million a year in the United States, that eventually get such pain and nothing helps anymore. It impacts the way they walk, the way they function. They can't sleep at night anymore. They have to take pain medications. They can no longer lead a normal life on account of that joint. But if it gets that bad, then they can get a joint replacement if they like. And that nowadays happens so often that there are several physicians in a town like Baton Rouge that are specialized in doing almost only that, and I'm one of those. So that's my interest, my calling, that's what I do as a professional. But within that field though, there's even further specializations. So certain joints are exceptionally difficult or unusual, and that's really where my heart goes. Those people that might get rejected by other orthopedic surgeons, that's where I come in. That's the cases that I love to do. And then also, there are some people that have their joint replaced and something went wrong, either an infection or something broke, or people are just unhappy. Sometimes the joint is loose and the original surgeon doesn't realize it. And so I like to call those the unhappy knee replacements, unhappy hip replacements, is the joint's gone bad. Fortunately, that is rare, but if it does happen, most orthopedic surgeons don't feel comfortable taking care of those patients, and so that's where I come in again, and that's what I love doing. So from all over the state, even outside of the state, people that have had a bad result, have a particular complication or any kind of issue that is not welcome with any other orthopedic surgeon, well, they certainly are welcome here. People oftentimes come in for a consultation and I explain what the problem is and what can be done about it, and some of those patients come to surgery and many of those end up eventually being happy with the joint. And now that is probably the most satisfying part of my work, is to offer solutions where others could not find them. So that's what I love to do.